We spoke with David Kurtzman, DDS, in his Marietta, Georgia office to understand how he approaches the special needs clients he serves.
Currently, it's a practice that serves people that basically can't be served or won't be served at traditional practices. By this I mean people with either special needs, like people with developmental disabilities, autism, things like that, people with medical problems that it's either unsafe or impossible to treat them in another office, or people with fears and anxieties.
How did you get involved in special care dentistry?
It's kind of found me. I've been doing hospital dentistry for about 30 years, and over the years word got out that I was doing this and people started coming in. I started getting additional training in communications, and I found after a while that I liked it. It was rewarding to me. It was different from the usual.
What is your philosophy towards special needs clients?
Step number one is my assumption that most behaviors that I run into on any of our clients are because they are afraid. So by creating as much safety as possible, I've been able to help. And the second is to treat everyone as a unique human being. And that goes for anybody from the people with the mild anxieties, validating their anxieties and knowing that they are theirs and they're real to them, and people with severe developmental disabilities. I've noticed that when I deal with them and I relate to them as humans instead of people with special needs, they do really well.
How do you handle the additional time that special needs clients require?
One of the great concerns I get from the people that see me, that small portion that either can't or won't function well in today's busy practices. And as an aside, up until about 18 years ago, I had a big practice. I had 7 staff people, I had 4 rooms, I had 3 hygienists going half the day. I was seeing volume. So there is a significant portion of people that don't fit in a volume practice. Matter of fact, no matter how much you want to help them, they're going to destroy your day. So the people that don't fit in a volume practice, that don't necessarily fit into a way of doing things that promotes efficiency, are not the kind of people that you can be efficient with. So your question about, is there a formula that I have? Not really. I basically have to, in as short a time as possible, determine what that person's concerns are and then address those concerns.
How do you use sedation dentistry?
Incorporating sedation into my practice was a decision that came about on one of those trial and error type things. For years, I just did dental work in the hospital. And if anybody needed sedation, I would refer it out to someone who did sedation. And one day we were sitting around talking and someone said, well, why don't you do it? And I said, well, I'm just not comfortable doing it. And they said, well, gosh, you're referring out so many patients a month. What's that costing you and how much is a hassle to them? And you might want to think about this. So I went and I took a course on oral sedations put on by a group called Docs. And I went and I took their weekend course, and it was outlined and structured in such a way that it made it really easy for me to understand and incorporate. And we came back and we tried it to see if it worked, and it worked great. And now it allows me to see more people with more levels of anxiety than I could before.
What portion of the work week do you spend on special needs dentistry?
A half day a week of dedicated screening for people with special needs, and 1 full day a week of dedicated time in the hospital operating room for people with special needs. We also do about, I'd say, 20 to 30% of our normal day-to-day with people with fears and anxieties, and the rest, somewhere between, I guess, 80 and 90% of just general dentistry for people who prefer a smaller, more personalized practice.
Describe your work with the Ben Massell Free Dental Clinic.
The Ben Massell Dental Clinic has been kind of my cause célèbre since I was in dental school, when we basically had to go there because it was part of our rotations. And the Ben Massell Dental Clinic, for those of you who don't know, is the longest running, oldest general dental clinic, charity clinic in the United States. It started, gosh, I guess in the 40s, providing free care downtown Atlanta. About 6 or 7 years ago, we got a new $6 million facility. It's nicer than my office. And I am on the board of directors, which I have been for 10 years. And I basically go once a month and I give essentially free dental care to people that need it. I'm not the only one. There are actually 108 dentists that do it. Each one of us gives anywhere from a half day to a couple days a week, and it's kind of the heart and soul of Atlanta dentistry. I'm really proud to be part of it.
What advice do you have for your colleagues about special needs dentistry?
Each one of us practices in a way, or should practice in a way, that is most comfortable and most meaningful to us. If a client like that causes you and your staff and your office anxiety, if it ruins your office flow, in the best interest of that client, refer it to someone who deals with someone like that. If it's something you'd like to get into, if it's something you're interested in, then realize that the time to let this person feel safe, to trust, to attach to your office, to let go of some of their defenses is necessary. There's really no way around it. So plan on a little bit of extra time, plan on a little bit of extra listening. Imagine that you're one of your loved ones and you really care about them, and that's a good way to start.
What would you say to dentists who are considering special needs dentistry?
Look into it. Check it out. Get a realistic idea what it is. If their bent is an untapped market, you're going to get hurt bad, because this is not something that you can make into a machine, unfortunately. And that's not a bad thing. I mean, if you're looking at a very profitable, very efficient practice, that's great. We need those. This really doesn't fit that model. But if you find that practicing whatever type of dentistry you're practicing isn't fulfilling your wants and your desires, this might be something that could interest you.